Ramadan.
Assalamu alaikum wa rahmatullahi wa barakatuh. And we are back on the mid morning talk show with myself, Rashida Khan. And I'm very, very privileged and honored to have a very, very renowned and eminent psychiatrist on the line. Next, we are speaking with Dr. Shaquir Salduker, who is a psychiatrist and a director at the Durban Pain Clinic. Welcome to the show. Assalamu alaikum, Shakir. Good to have you.
Walaikum salam. Thanks, Rashida. Thanks for the invitation.
You're welcome. I'm going to get right into it because I've got loads of questions. I don't know if you remember when I messaged you last night. I said, I've got so many questions. I don't know if we're going to get through all of it, but we're going to try. So, Dr. Salduker, we're talking today about substance abuse, which, of course, is a real challenge in our communities and our societies. I don't think anybody knows of or doesn't know of a family or a situation where this has affected somebody in some kind of, it's insidious. Drugs, alcoholism, this kind of thing is insidious. And I mean, there used to be a time when we could say, oh, as Muslims, this doesn't touch us. Unfortunately, that is no longer the case. So in South Africa, Shakir, South Africa faces this rising substance abuse rates, whether it's alcohol to opiates like nyope. From your frontline experience, what do you think is driving this crisis? And are we seeing any new trends that are worrying you?
Yeah, look, this has been a problem for, as you said, a long time. There's definitely a lot more awareness now, and people are talking more about it. So it's coming out of the shadows a little bit. I think the trend, if we're speaking in general, that's worrying for me is this recent legislation with cannabis, which has made a lot of people think that cannabis is safe and legal, and it's neither. And the other thing that worries me is the increase in the amount of something called lean. Lean is where they mix codeine into cold drinks. And this is being done from children as young as 9 years old. And it's the same as heroin. So, those two have been more recent additions to the drug problem. But the older ones, like the cocaine, the heroin, the alcohol, are ongoing problems. And, there's a rise in things like mushrooms that are being used for what is deemed to be therapeutic uses, but is still illegal in this country. And MDMA, which is ecstasy, also being tested abroad for therapeutic use. So all of those things are happening. But in terms of South African demographics, the two worrying things for me are the rise in cannabis use, because it's a very dangerous drug that causes serious damage to people's brains over long periods of time, and the rise of this codeine use in this country, which has always been there, but in the form of like painkillers. And South Africa is one of the few countries in the world where you can still get codeine without a prescription. In other countries, Canada, for example, before you give anyone a codeine or an opiate product, you have to sit down and counsel them and get them to sign an informed consent about all the risks associated with it. And here you can walk into a pharmacy and buy a box of 20
just over the counter.
Over the counter, and go to the next pharmacy and buy another 20, and no one cares.
Yeah, no one can track that. I mean, that's one of the, I imagine, the bigger problems, the fact that these things are so accessible. They're so easily accessible. Mixing codeine, like you say, you can get 20 from this pharmacy, go down the road, get another 20. Nobody's tracking this, and buy a can of cool drink, mix this up, and you're going to have your high. So it really is, very, very difficult, I would imagine, to even understand the extent of the problem before we can even start addressing it. I want to take a slightly different tack now, because I often find that many people, and you'll correct me if I'm wrong, but many people still view addiction as a moral failure, which maybe it's that is how it starts. But I would imagine it's more a health issue. Is addiction more a health issue? And how do you confront the stigma? What's the biggest misconception around this, as whether it's a moral issue or whether it's a health issue? And is there anything that we can do to start addressing that?
So, firstly, addiction is a disease.
Yes.
Um, Abuse or overuse are more sort of social issues. But addiction itself, a person can be declared an addict if they have two things. One is a tolerance. So, in other words, they can take lots and lots of the same thing and the effect is minimized. So,
Mm-hmm.
that's called tolerance. And dependence, where they can't do without it and they develop withdrawal symptoms when they don't use it.
Mm-hmm.
So, that's addiction, and that's a brain disorder. So there are parts of the brain, and specifically it's called the ventral tegmental area, which is run
Mm-hmm.
by the dopamine system in the brain. It's dopamine is the fuel or the
Yes.
chemical that runs it, that gets activated in addicts. And when that center is activated, it stays active even a couple of years after the person has stopped using a substance, which means that you're still an addict even though you're not using. In other
Right.
words, the threshold for you to relapse is pretty high. And it takes on average 2 to 3 years of being clean before that part of the brain sort of dies down and is no longer as much of a problem. But associated with that, it's a very complex issue because we talk about primary and secondary. So people who use drugs for pleasure, and
Mm-hmm.
there are people that end up using drugs for pain, for emotional pain or physical pain, like
Yes.
painkillers, for example. There are lots of patients that get addicted to
To
codeine, which
pain.
is the same as
Yes.
heroin,
Mm-hmm.
because it's prescribed by their doctor. And there are a lot of people that take drugs or drink alcohol because they're anxious. So they are
Yes.
using it to suppress their pain.
Mm.
And yet and the other half, the other group of people who use it purely for pleasure and get addicted on that basis, are not self-medicating, but are sort of more hedonistic and pleasure-seeking. Those are the ones that
Yes.
are more problematic because there is
Right.
the underlying primary problem is addiction, whereas the
Right.
ones that are using it for underlying conditions, the primary problem is the underlying
It's
condition.
condition itself.
Yeah.
Okay. So, I mean, that brings me to my next question. Because I imagine it's quite difficult to balance that, or you must have ways or means of balancing that. So, as director of the Durban Pain Clinic, you see patients managing chronic pain, maybe people who are vulnerable to opioid dependence. How do you balance pain relief with addiction prevention?
So unfortunately, a lot of what we're talking about now, a
Mm-hmm.
lot of normal, sort of the average general practitioner, and even a lot of specialist surgeons are not really cognizant of the difficulties that patients go through when they prescribe these drugs. So a lot of what I
Right.
see in the pain clinic are patients who are put on these drugs by their doctors and are
Mm-hmm.
told to take, for example, a painkiller, 2 tablets, 3 times a day after an operation. And they come to me 2 years later and they're still on the same painkillers.
Wow.
Um, you know, uh, there's a general lack of understanding of the exact. I mean, people know vaguely. The medical professionals know vaguely. There's a problem there, specifically because in America they're having such a huge crisis with opiates,
Yes.
and
Mm-hmm.
that has created a lot of awareness around it. But most people
Mm-hmm.
don't understand intrinsically. The difference between knowledge and wisdom. They have a little bit of
Mm-hmm.
knowledge about it, but they don't understand intrinsically how devastating these drugs can be. Painkillers actually cause the patient to have more pain because they lower their pain threshold. So,
Wow.
what happens in the brain is the more painkillers you take, the less endorphins your brain produces because endorphins are the same
Your natural
compound,
painkillers, right?
correct? So, if
Hmm.
you are putting it into your body, your brain is saying, well, there's enough circulating.
I don't need
I'm
to
not going to
produce it.
produce my natural
Hmm.
painkiller, which incidentally is 30 times stronger than morphine. So
You.
endorphin is the strongest painkiller known to man. And when we take oral painkillers or injectable painkillers, the brain produces less. But what's interesting is endorphins actually set our pain threshold. So the more endorphins we produce, the higher our pain threshold. The less endorphins we produce, the lower
The
our
lower
pain threshold.
pain threshold.
So when you take painkillers and your brain produces less endorphins, your pain threshold goes down and you feel more pain. So, ipsi facto, the painkillers cause more pain.
Mm. So it's actually a vicious cycle, hey? And
Completely.
but what you're saying is interesting because you're saying that even surgeons don't realize this. So is there an issue with the education, with at medical school level? Should we be intervening at that level, do you think?
Absolutely. And this
Mm,
is a criticism and a one that I brought up with the faculty at our university, and they've been trying
mhm,
to introduce pain management. We were taught
mhm.
in medical school as of pain as a symptom of something else, and you focus on the something else. There hasn't been
Right.
enough emphasis on the focus on pain specifically, because chronic pain actually is a condition unto itself. A normal pain, like if you fall down and hurt your wrist, it's a
Mm,
normal pain that's result from injury, and your brain kicks into gear and it produces anti-inflammatories and it produces endorphins for pain. And if you just leave it alone, obviously if it's manageable, it will heal on its own. But because people want instant gratification, they go immediately
mm,
seek medical help, get put onto opioids, get put onto anti-inflammatories, and therein starts can be a problem, you know.
mm,
But chronic pain is where there is no structural reason. The patients are in pain because
mhm,
their entire nervous system, from the nerves to the spine to the brain, is just
mm,
hypersensitive, completely hypersensitized. And as a
mm.
result, and the endorphin levels are low, so as a result, they just have pain. And things, they call it names like fibromyalgia and chronic
Yes.
pain syndromes and tension headaches and irritable bowel syndrome. These are all conditions which fall into the category of chronic functional
Chronic.
pain.
Mm,
Yeah.
mm. Okay. So, I mean, I think there's a lot more we could say, but I want to move on a little bit about onto substance abuse and how this affects a person's life, right? So it not only affects a person individually, but it fractures their relationships. It can fracture all their relationships. What's your advice to families who feel helpless watching a loved one spiral? How can they support and do it in a way that does not enable the addiction or the person to continue with the addiction? Is I mean, I know it's not a one size fit all answer. I'm sure every case is different, but if there's something general that you can say to families who are watching or are going through this with maybe a child or even a spouse. We know now that it's addiction cuts across all age groups and all cultures and every kind of economic background. So what would you say to families who are watching this kind of thing? What can they do to help?
So the thing to do is to understand the problem, and unfortunately, the understanding um, is sort of understood in silos. So you get people who run rehabs have a particular understanding of it. You have general practitioners have a particular understanding. You have the cultural differences in understanding, um, and one has to kind of because this is such a devastating and potentially destructive condition for families, for relationships, for independence, and so on. One has to go back to basics and ask simple questions, before you
Mm,
complicate the problem. And the simple
mm,
question is: if a person is an addict, their brain is their brain damaged from the
mm,
drugs? Because if their
mm,
brain is damaged, it means that their insight, their judgment, their
mm,
ability to process information, their ability to apply themselves to coming off the drug and staying off it is all reduced. So, what we have in reality is a situation where these patients are shunted off to these short term rehab programs,
perhaps,
which run for
yes.
21 days, 28 days. And as I said to you earlier, it can take up to 2 years for
Mm,
the brain to recover from an addiction disorder. So in that 21, 28 days they're there, that person's brain is not functioning properly. Now
mm,
they're supposed to attend groups and they're supposed to learn complex concepts and participate in these groups. And a lot of them, end up being just respite for 21 days for the family, because they get a bit of a break because the person's gone to a rehab, and the person gets a bit of a chance to kind of redeem themselves and say, well, I'm
Mm,
trying something.
mm.
But in reality, the problem is drugs cause damage to the part of the brain that you need to actually stop drugging.
Wow.
That's the problem. And
Yeah.
you need between a year to 2 years of some kind of external locus of control, because that person is not going to have an internal locus of control
Yes.
that's
He
going to be
can't
able to
manage it.
in
Mm,
exactly. Yeah.
mm. Yeah.
So that's the
So
problem.
yeah, so for what you're saying, I mean, I've always known that there's no easy solution, there's no easy answer, but from what you're saying, it sounds like we have to have a holistic approach, not just the medical professionals, not just the family, not just it. Everybody has to work together, and you're in it for the long haul. It's a long-term thing. It's not going to be something that we can just fix overnight. There's no magic wand. There's no magic solution.
So the rehabs in this country have the highest, well, in the world. It's not a South African problem. It's a world
Yes.
problem. They have the highest recidivism rate. That means that people come and go to rehabs frequently, all the time. So because the approach, for example, there's an alternate approach called it's where they don't stop people from using it, but
Mm-hmm.
they make sure that you use it in a safe manner. Now, the medical
Okay.
profession, from coming from the medical profession, um, we don't necessarily agree with that, because the whole point about it is the more you ingest, the more damage you're doing to the brain.
Mm-hmm.
So stopping the drug is the way to go, you know. Um, but because it's such a difficult problem to solve, people have come up with alternatives like safe usage. So, for
Mm,
example, people that use heroin, they would say, okay, come to the center where you can get clean needles, so you don't spread
mm,
HIV and TB. You can
mm,
come and
mm.
use your heroin, but we'll give you clean syringes, clean needles, things like that. Simply because this model that we're using currently worldwide of trying to attain complete stopping of use is just so
Not
unsuccessful.
working. Mm.
Yeah.
Yeah, so we have to try and look at alternatives. But I imagine that's not going to be an easy one or something that's going to be solved quickly. But I'm sure over the many years in your practice, you've had lots of success. You've probably treated patients who've rebuilt their lives after addiction. What does successful recovery actually look like? And what's a case that's reaffirmed your hope, that's made you want to continue in this very, very challenging, and I imagine which can be sometimes very demoralizing path that you're on?
Look, I see predominantly opiate use problems because of the fact that I run a pain clinic. I mean, I
Yes.
see a lot of cannabis related problems, and I see a lot of alcohol related problems in my psychiatry practice. But just
Hmm.
from an opiate point of view, when you get a patient clean and they realize that they're taking less medication, but their pain has gone away. And this is something I see on a daily basis. It's not an uncommon thing.
Hmm.
Is a very sort of positively reinforcing phenomenon, and one that sort of makes me get up and go to work, because these patients that I see in the pain clinic are the sort of, so we like the last port of call, because they've been bumped from
Mm.
pillar to post, sent from specialist to specialist, had multiple operations, procedures, tests, spent hundreds of thousands of rands on their condition, and all we have to do is go back to basics, get them off their painkillers, get their endorphin levels going again. We do have an exercise program, we have physiotherapy and psychology involved. So it's very rewarding to see these patients come back and say, doc, I haven't even taken a Panado in the last 6 months.
Yes,
So,
amazing.
that's kind of the kind of thing we're looking for. When it comes to the
Hmm.
harder drugs, it's more difficult. What I've started doing now to try and get patients to stop using is I do a scan of their brain, but it's a very specific scan called a SPECT scan. It tells us how
Hmm.
your brain is working. The normal scans are the CT and the MRI, which are more
Right.
structural scans. They just look at the brain as a
Yes.
photograph. But this
Hmm.
tells us how it's working. And 99 out of 100 times in some youngster who's smoking cannabis for a few years, that scan is very abnormal. And that for them is a visual evidence of the damage they're causing at the starting, at such a young age. And that gives them the impetus to kind of start saying, well, I don't
I
want to be
have to stop.
permanently brain damaged. And
Mm,
that's made a huge difference. And with cannabis, because it causes such a subtle kind of uh, almost psychosis in patients, it takes months before they start to feel their heads clearing up, their thought process clearing up, the
mm,
insight returning. And when they get that feeling, then it's much easier for them to refrain. But to
mm.
get them to that point of feeling the difference between being in a drug haze and being out of it is the problem, unfortunately.
Yeah. Okay, well, I can tell that we could carry on talking, but my producer's signaling me that I have to wrap up. So I'm going to ask you one last quick question, please, Shakir. If a listener viewer suspects they or someone they love has a substance problem, what's the first step that they should take?
You need to contact a professional,
Mm-hmm.
either a psychiatrist or you can go to a rehab. But remember, a
Uh,
lot of times they have to be detoxified first. A lot of drugs, when you stop suddenly, you can have bad withdrawal symptoms. So we often
mm-hmm.
admit patients to hospital for a week, detox them, and then refer them on to rehabilitation programs, whether they're outpatient or inpatient. But you can't, to seek help in the wrong places, because remember, families are desperate, and a lot of people will pay any amount of money to help their family members get better. And
Mm,
unfortunately, the rehab, a lot of the rehab industry in this country is really a financial drain. So
mm,
people end up, spending a huge amount of money, and they don't do a proper long-term rehabilitation process, and they keep going back over and over again. So unfortunately, yeah. So you got to start. I think see a GP, get referred to a psychiatrist, get an assessment. Because if you have an underlying disorder like an anxiety disorder or a depression, and you're
mm-hmm.
using the drugs as self-medication, that's easier to manage than someone who's just using it for pleasure and for hedonistic purposes.
Yeah. Okay. Thank you so much for that. I appreciate your time, Shakir. I know you're a busy person. And yeah, I hope that, I mean, I've learned a lot today. I was writing furious notes as you were talking, so I've learned a lot today. And I think that is one thing that we can do, is to create that awareness, to get people understanding more about this problem. Because if we start, breaking it down and making it more accessible to the person in the street, because those are the people that are being affected. We all going to be affected, whether it's ourselves personally or anybody in our family. So the more information we can get out there, the more we can talk about what works, what doesn't work. I think that maybe will be some way towards starting to stop the problem. I know we have a long way to go, but inshallah, with people like yourselves, with others who are working very hard, I know there are lots of people, lots of organizations in many communities that are really, really fighting on the front lines, fighting this war on drugs. And I wish everyone and yourself all the best. Inshallah, we will speak soon again. Jazakallah khair for your time. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam. Thank you.
Thanks. Thank you very much. And that was Dr. Shaquir Salduker from Durban at the Durban Pain Clinic. And yeah, a lot to think about, a lot of learning today. And I think next time I'm on the show, I'm definitely going to have a show dedicated to substance abuse, because there's so much that needs to be said and there's so much that needs to be taught. And on that note, we're going to take an ad break.